Good evening, everybody. I'm Dr. Isaac, LJ, Georgia. Just finishing up with the day, and as promised, trying to keep everybody informed. My mask is coming off, so if my staff could step back a little bit, I appreciate it. Once again, we're just trying to keep our social distance during this unprecedented viral infection. I asked you yesterday if you would give me a couple questions that I could help you with, and you guys came through for me. By the way, hello to everybody who responded kindly yesterday. Thank you. So the three things that I want to go over today. Number one, I just want to reiterate about our telemedicine. We have a software program that we're using for our telemedicine visits. You could access us from your home, from your work, if your work is essential. You could, if you have trouble reaching us through the internet, through your computer, where we use Facebook as well. We use FaceTime Messenger and an app. It's called WhatsApp. You could access us through that as well. In addition to that, we also recognize that some people have difficulty accessing the internet in our rural county. So we set up a site for telemedicine for the community in the Highland Shopping Center. If you call the office before you show up at Highland Shopping Center, call the office and we'll let you know where exactly that's set up. Right now, it's behind Subway and in the parking lot of our office. There may be other locations around Gilmore County in the future should the need arise and the need deem it necessary to expand that service. We'll do everything we can to help this community and help anyone who needs help. The question about telemedicine came up is some of my patients or some people said that they would really rather see me in person as opposed to seeing me on telemedicine. And I agree. I would rather see you in person too. One of my oaths is to do no harm as a physician. And if you have a minor issue, I would rather right now see you on telemedicine because I would hate for you to have an ear infection or a bruised arm, and the list goes on, that I bring you in the office to see personally, where you end up unintentionally getting exposed to COVID-19 when I could have treated you without bringing you into the office. Understand, it is my deep belief that the relationship between a physician and a patient is a sacred one. And it is an honor and a privilege to be able to be your doctor. But I need to keep you safe. I can't put you at risk to bring you in my office for reasons that I believe I can treat you outside my office. I have been known to see patients in the parking lot. I have brought patients in, following a telemedicine visit, recognizing that they really did need to get in with me so I can do an appropriate physical exam on them for whatever disease was going on. The majority of the patients that I see, though, can be seen on telemedicine, and I kindly ask you to respect that, recognizing that I would rather be seeing you in person than on telemedicine. But to keep you safe, we need to do it this way right now. Okay? Question came up about COVID-19 and could it have been in our area as early back as December and January. And, there's really not going to be a great answer for that right now until further research is done, but the likelihood is no. If you think about how many people are hospitalized with COVID-19, the severity of the cases and things like that, in January, many Americans were not hospitalized. It ended up being, into March and April, where the hospitalizations started occurring, and that's really where the numbers started growing. I can't absolutely tell you that it was not in our country in January. What I can tell you is that it is highly unlikely, based on the genetic studies that are done with this virus by those people who do genetic studies. It seems like when the hospitalizations started growing is when the COVID-19 was present in our community and in the United States at large. Another person asked me about nutrition at a time of a pandemic, and my answer would be the same as if it was at any time. I'm a big proponent of nutrition and exercise for prevention of disease. I'm a big fan, as a lot of my patients know, of leaning more towards a plant-based diet. I follow what I call the 90-10. 90% of my meals, 90% of my diet is plant-based. 10% is not. 10%, I may have some dairy, I may have some meat, but I really, personally, I can tell you that I'm healthier as an individual because I follow a plant-based diet. My immune system, I believe, is at peak following a plant-based diet. Any particular plants, herbs, and things like that, as the questions were coming in. And the bottom line is, right now, stick to fresh fruits and vegetables as much as possible. If you can't get fresh, get frozen. If you're a meat eater, just decrease the portion size. Your immune system takes a lot of energy, requires a lot of energy to fight infection. Your digestive system requires a lot of energy to digest food. If you give your digestive system difficult foods to digest, or food that takes a lot of energy to digest, like fatty foods, like foods with a lot of preservatives in it, fatty foods being a lot of red meat, pork, dairy, cheese, butter, eggs are even high in cholesterol. Those foods take your digestive system a lot of energy to digest, and we only have so much energy in our system. So if your energy sources are being depleted for digestion, then you don't have those energy sources available for the immune system. So to keep your immune system at peak performance, eat a light diet, eat fresh fruits, eat fresh vegetables. The same thing that I would tell you on any given day of the week. Exercise is an important addition to this. Aerobic exercise helps the immune system within reason. So you want to do light to moderate exercise on a daily basis. And I'll be honest with you, I talked early on, or sent a Facebook message early on about practicing +1. +1 to me means that if we're told to stay 5 or 6 feet away from each other for distancing, add a foot, stay 7 or 8 feet away. If you exercise on a treadmill every day for 30 minutes, do 31 minutes. If you're doing sit-ups, push-ups, curls, crunches, anything like that, and a lot of us do reps of 10, do reps of 11, practice +1. If you wash your hands for 20 seconds, rinse and repeat, do another 20 seconds, stay healthier. In the shower, use soap and water, please. But rinse and repeat. Let's get this virus off of us, and it'll help us get healthier. It'll help our neighbors get healthier as well. So I'll do this every Monday through Friday in the evening before I leave for the day. I appreciate all the kind comments. Again, it is my privilege to do this, and it is my privilege to be your doctor for my patients who are listening. Have a great weekend, guys. I'm close by. Don't hesitate to contact me. Thanks.